Every single one of us knows someone who has faced cancer at one time or another. And today we are talking specifically about prostate cancer. Dr. David Morris is a radiation oncologist and medical director at St. Louis CyberKnife, and he is here to tell us how CyberKnife treats prostate cancer. And thank you for coming in today.
Well, thank you.
Talk to us about what some of the risk factors might be for people when you're looking at, in particular, at prostate cancer.
Well, the biggest risk factor is being a male, and it's very unusual to see prostate cancer in men under the age of 40, but as men get older, it becomes more frequent, with about 1 in 6 over the age of 65. I'm sorry, 6 out of 10 over the age of 65 developing prostate cancer.
Wow, that's a pretty high number. They used to say that prostate cancer is the cancer that you die with, but not of. But that's not necessarily the case. Is that right?
It's not necessarily the case, but that is still probably the more frequent manner that people have prostate cancer.
And it can make life very, very difficult.
Well, I think when people develop symptoms from prostate cancer, when it gets more advanced, it can be problematic.
And the diagnosis is one of those things, like when we talk about colon cancer and prostate cancer and things, it's not always the easiest in people's minds that this diagnosis process, what you have to undergo. But it's probably not as bad as what most people think.
There's clearly anxiety associated with it, and PSA screening, in my opinion, has helped. What's been an issue is trying to determine the appropriate people to do PSA screening. And at the current time, between age 55 and age 70, it's recommended to have a discussion with your primary care physician about the role for PSA screening.
What are there? So if you're male, obviously there's that higher risk. But are there other high-risk factors like family background and things like that that we need to take into account?
Yes, immediate family members with prostate cancer are at higher risk. If you're African American or Caribbean descent can be also.
All right. How does CyberKnife treat prostate cancer differently than what we might have heard about in the past?
So in the past and still today, the treatment options that are for localized prostate cancer of early stage would include either active surveillance or observation in older patients, would involve surgery, or would involve a course of radiation that typically would be close to 8 weeks or 9 weeks worth of therapy. Occasionally, and in the past as well as today, it's also treated with internal radiation called seed implant. What CyberKnife has allowed us to do is to treat with a non-invasive approach, so no surgery or no internal seeds, and treat in a shorter time course.
And that's going to be reflected in the cost. That's going to be reflected in the comfort level of the patient as well, right? And the anxiety, because it's not stretched out as long.
Correct. And people can do basically what they were doing beforehand. So if you're working, that's something you can continue to do during the course of the therapy.
Very important in people's lives. All right, thank you very much for being here.
No problem. Thank you very much.
Nice to meet you. And St. Louis CyberKnife is located in Fenton, conveniently located. If you can give them a call at 636-496-4660, and you can also find them on the web at stlouiscyberknife.com. St. Louis CyberKnife is a service of SSM St. Mary's Hospital.
Thank you very much, gentlemen. Coming up on Great